The next presenter is Dr. Tara Liu. She'll be presenting single incision, single instrument Adnexal surgery in pediatric patients.
Good afternoon. Thank you for the honor of presenting our work here today. I have no disclosures. In 2008, the first single incision, single instrument adnexal surgery was performed in our institution. Our Sisi technique consists of placement of a transumbilical 12mm trocar through which we use an all-in-one operating endoscope pictured here. Note the attachments for the camera head and the light cord. There's also a 5mm instrument port through which a long instrument can be inserted. Typically, we use either a toothed grasper or a suction device with the capability of performing cautery with the tip. Torsions are usually easily reduced with a grasper. Larger cystic lesions can be decompressed with a transabdominal spinal needle while holding the lesion stable with an instrument. If a cystic or solid lesion requires resection, the adnexa can almost always be extracorporealized through the umbilicus for this to be done under direct vision. In retrospective review, I found that the Sisi technique was attempted in just over 50% of our adnexal surgeries. In those surgeries attempted via Sisi technique, half were completed successfully in patients widely ranging from 1 day of life to almost 20 years old, with weight range from 4.7 to 117 kilograms. About half were converted for various reasons, including oophoropexy, finding of a solid mass, and inability to mobilize the adnexa sufficiently to bring it out of the umbilicus. This graph depicts operations by year as a percentage of total adnexal surgeries. As you can see with green bars, Sisi attempts increased dramatically after the first 2 years, such that currently between 50 and 70% of all adnexal cases are being attempted with the Sisi technique. Successful Sisi surgeries have also increased, while initial attempts at multi-port laparoscopy have decreased. Our complication rate was 11%, including presentation to the emergency room with any complaint in the 30-day postoperative period. All complications were felt to be minor and resolved with minimal treatment. 5 patients experienced recurrence of benign disease requiring reoperation. Their initial operations were scattered over 4 different initial approaches. In conclusion, we feel that the Sisi technique is safe, effective, economically prudent, and cosmetically appealing. We're applying it even more broadly to treatment of such entities as Meckel's diverticulum, removal of gastric or intestinal foreign bodies, duplication cysts, and empyema. I thank you again for the honor of presenting today and would be happy to entertain any questions.
Dr. Harmon?
Very nice, Tara.
Thank you.
Great to see you.
Likewise.
So I know the time was short, so you couldn't really talk about technical details too much, but my question will be, can you give us some insight sort of about the technical aspects with what you're using?
Yeah, so I think the main goal of the single incision, single instrument technique is to extracorporealize the pathology in whatever way that you can. And usually you can do that through a 1 to 1.5 centimeter incision in the umbilicus and completely hide it within the umbilical scar. In order to do this, there's a couple of things. We will use a spinal needle that we put through the abdominal wall to decompress an ovarian cyst. We will also use, if the cyst is large enough to actually visualize through the umbilicus, we'll put a couple of stay sutures in it, make a hole, and just decompress it outside of the abdomen. Does that answer the question?
Congratulations, I enjoy your presentation.
Thank you.